Hello, welcome back. The topic today is stress and insulin secretion. So, we all know insulin is a metabolic hormone which is used for the glucose metabolism, but it also is very important for fat and protein metabolism. So, if there is less insulin, diabetes is the result. We all know that. And the stress part, most of the people think stress means depression. No, there is one part of stress is called depression, we can say, but it could be anxiety, it could be fear, it could be some personal problem, money problem, or even suppose somebody doesn't like the job and you are into the job, it's a stressful for them. So it's called chronic stress, or even sometimes health issues. Somebody has chronic diseases, so that can cause diabetes is one of the main reason for stress. The stress can cause diabetes, and diabetes can cause stress. It's very important to know. Okay, fine. Suppose stress could be acute stress or chronic stress. Acute means suppose you met with some accident or something happens, all of a sudden. Suppose animal attacks us, we respond to that by fright or flight mode. So what happens that time? Adrenaline secretion is increasing, as well as your corticosteroid level increases. Both are, especially adrenaline is completely stops the insulin secretions, and it also releases glucose from the liver. So naturally sugar level increases. So somebody is a diabetic, so the sugar will not come to the control. And the second one is the glucocorticoids. Glucocorticoids are exactly opposite to the insulin. So what they do, they increase the glucose level. Insulin decreases the glucose level. Glucocorticoids increase the glucose level, and the sensitivity of the insulin, the peripheral response of the insulin, everything comes down. So again, sugar increases. So if they are diabetic, sugar is not under control. The then is called the chronic stress. Chronic stress, again, it could be a disease, it could be a personal problem, money problem, anything. So what happens there is three things are happening. First and foremost is the hypothalamus-pituitary-adrenal axis response, where the adrenaline secretion is again, increase. So what happens? Adrenaline again, completely stops the insulin secretion, and also it increases release of glucose from the liver. So diabetes will not come under control. The second system is called renin-angiotensin system, where the final end product, the ADH, antidiuretic hormone, increases, which in return decreases the insulin secretion. Again, suppose somebody is having diabetes, no, it won't come under the control. The third is the autonomic nervous system, where the cardiac function is reduced, thereby indirectly affecting the sugar control. So whatever whether it's acute or chronic stress, again one more time, stress need not be only depression, it could be anything. Even if you don't like the job, it's a stress. Suppose you don't sleep at all, it's a stress. Disease, it's a stress. Surgery, it's a stress. So the body finally secretes two things very importantly. One is adrenaline, the other one is glucocorticoids. Adrenaline completely stops the insulin secretion, and also it releases the sugar from the liver, thereby affecting the diabetes control. The second one is the glucocorticoids. Again, they are completely opposite to the insulin function, thereby increasing the sugar level. They also reduce the insulin sensitivity in the peripheries, thereby increasing the sugar level, affecting the diabetes control. Okay, what to do? The first and foremost, we always say to beat the stress is always exercise. A simple exercise, simple walking, preferably 10 minutes after each meal, or a regular walk of 30 to 45 minutes a day can definitely beat the stress. Number two, a complete good sleep, adequate sleep of 7 hours in the pitch dark. The dark, from night 9 o'clock to morning 5 o'clock time, 7 hours of good sleep. That is very, very important. And also the next is how they should know how to relax and how to find a solution for the stress. So once they find the solution for the stress will not happen. So thereby easily you can control the your sugar control. So stress definitely will not allow your diabetes to be under control. Thank you.